Okay, today we're going to be doing an assessment of our newborn. So first things first, baby is going to be born. We're going to bring her over here, dry her off, get rid of that blanket, and put her on a nice warm one. Try to keep her as warm as possible. Because she's on a scale, the scale is going to go ahead and give me a weight while it is weighing her. I noticed she is just crying, so as she's crying, I see her trunk and most of her extremities are pink. Looks like she is breathing. Her chest is not labored at all as she's crying. So she's perfusing well. Her hands and feet have normal acrocyanosis going on. But I'm not too alarmed, so I will check. I'm going to count her respirations for a full minute, and that's going to give me between 30 and 60. We'll say that hers is a 40. And I'll listen to her heart in all 4 areas. And once I get to that mitral area, I'm going to count her pulse for a full minute. Her pulse is going to be at, we'll say 135. Should be between 110 and 160. Because I'm listening, I'll go ahead and listen for those vowel sounds. And she is going to have normal active vowel sounds throughout. All right, looking at my baby again, I'm going to go ahead and take her axillary temperature. It's going to be 98.5, which is very good. And while I was checking her temperature, I'm just looking. I noticed she has some lanugo along her shoulders. She has some vernix in her creases, which is perfectly normal. She has a couple superficial veins here on her belly, but she's term, so that's normal just to have a few. I can go ahead and take my measure, and we're going to measure her length in centimeters. Since we have her weight of about 8 or 7 pounds, I see her length is 44 centimeters, and I'll go ahead and measure in inches for mom and dad. She is going to be 18 inches. And I'll go ahead and let them know, oh, she's so perfect. We'll go ahead and get the circumference of baby's head, and that's going to be 36.5 centimeters, and I'll go ahead and feel for her anterior and posterior fontanelles. They are soft, and there is no cephalohematoma, no kaput going on, so I'm not worried about those. I'll get this all the way up. We're going to measure her chest circumference. It's going to be 34 centimeters. And we'll get her abdominal circumference too. That way we can figure out if there's any changes. She may have an obstruction. So that's going to be 34 centimeters also. Okay. Once I check that, I'm going to go ahead and cover baby's eyes. See if we can get a nice blink reflex. That's very good. Cover her eyes. We're going to check her pupillary response in both. It's good bilaterally. Now here I'm going to look, her eyes are symmetrical, the outer canthus lines up with the top of her ear. Her cornea looks clear, her sclera are a nice white color. I see that her ears have folds on the inside and out, and that her ear canal is present and open on both sides. I'll check for her recoil for her pinna here, and it readily recoils, which is good. I'll go ahead and check for any excess folds in the back of the neck. No webbing on either side here. Now that I'm at my chest, her breathing is still not labored at all. We'll go ahead and check her buds. Since she has some buds as a term baby, we're going to go ahead and measure them, about 20 millimeters on either side. Okay. While looking at her abdomen, I note her umbilicus is midline. She has 2 arteries and 1 vein there on the umbilicus. And From here, we'll go ahead and check a couple of her reflexes. If I stroke here, she's going to turn towards me, letting me know that that rooting reflex is present. If I put my finger here in her mouth, she's going to start suckling, and that'll let me know that her reflex there is present. I'll feel while I'm there. Her hard and soft palate should not have any grooves in them. And it should be strong. I'll go ahead and check her nares on either side. Make sure she's able to breathe, and they're patent on both sides. From here, if I tilt her head one direction, she is gonna point out, give me that good fencing status. So her reflex there is good. I'll go ahead and feel, make sure she has 5 fingers on each hand, and check her palmar reflex at the same time. I'll come down here to her toes. She has 5 toes on each, and I'll give that a nice stroke and see those toes fan out for her plantar reflex. If I pick her up, she's going to give me a nice stepping reflex going. And if I put her on her belly, she should have a prone crawl for me. And while she's here on her belly, I'm just going to check her spine. There is no pits in the spine. It looks like it is midline. There's no tufts of hair or holes there at the sacrum, so I'm not concerned about that. And our gluteal folds look symmetrical, so I'm not concerned about any hip dislocation yet. If I give a snap, she is going to startle, and both hands and feet will come out at the same time, so I'm not concerned about any clavicle breaking from labor, and I don't feel any. That's good. I'll go ahead and check femoral pulses here. We've got good pulses on both sides, and the inguinal area has no excess webbing. We'll go ahead and check genitalia while we're here. Her mom's, her clitoris, and her vagina all look to be normal. Her labia are a little bit swollen, which is just fine. She has a perfect anus, so I'm not concerned about her being able to use the bathroom. I'm going to go ahead and let mom know that she should have 1 diaper within the day, because for now I don't know any green staining, which would indicate meconium in utero, so we need to make sure that she is able to pee and poop before she goes. Okay, we are going to go ahead and check, make sure that she has that nice reflex. If I stroke her back, she's going to give me a C curve for that C reflex. We're going to make sure we haven't forgotten anything in here. Okay, while feeling baby's skin, I noticed it was smooth. There's nothing sticky, which would indicate preterm labor. I did also note that that the eyelids were able to separate, so there was no fusion going on there. And because she had normal skin tone, I was not concerned about any pathologic jaundice or physiological jaundice just yet. That would be within the next couple of days. And because she has been turning towards mom every time she hears her voice, I think that her vision should be just fine, and her hearing is probably good too. Also, she was breathing normally, chest was expanding and retracting normally, no heaving, no grunting. So she is doing just fine. So I'll wrap her up and get her warm.